You are the unfortunate nurse who's taking care of room 154A. The patient rings the call bell, and you start to go toward the patient's room. At the same time, the red phone is ringing on your unit, and a nurse is calling over that there's something wrong with your patient in your room. There's a change in the rhythm. The monitor room calls the tech, but in the meantime, you go into the room, because what we always do is assess the patient before we treat any rhythm at all. We treat the patient, not the rhythm. So, as the previous video showed, we previously had the patient on a 6-lead telepack. One of my leads fell off. Okay. I'm going to anticipate that I may need to either shock or pace the patient, so I'm going to place the pads on the patient in accordance with the manufacturer's recommendations. I'm going to also connect them to the monitor leads of the LifePak, which I'm using, the 20E, and turn the monitor on. And I'm waiting for the news of my patient. Oh dear. I have a very fast, narrow complex, narrow QRS. I'm missing P waves, so I have one waveform between the R waves, and I have a rate of 212. That indicates that we're in atrial tachycardia. If the patient is awake, they may be confused, have some chest pain, have difficulty breathing, be hypotensive. This qualifies the patient as being unstable. If we are able to, we're going to pre-medicate the patient, but we do need to cardiovert this patient. We do that by hitting the sync button. The flashing light comes on here, and you see the carets on top of all of the R waves up here. Based on this patient's presentation, the physician's at bedside. He will recommend that we cardiovert the patient at 100 joules, so I'm going to dial down. I'm in test mode on this, so I'm going to charge it.
Remove test plug.
Okay. I'm clear, you're clear, everyone clear. And when you cardiovert, you need to press and hold the button, and it deploys the energy, and voila. The patient converts back to a beautiful sinus rhythm at a rate of 79, no matter what. Always check for a pulse, see if the patient's perfusing, and see how they tolerated the procedure.